My name is Misty Arrington. I am the new Director of Clinical Education with the University of Kentucky PA program. I'm most excited about clinical placements, establishing new relationships with preceptors, and serving our local community to fulfill the healthcare need. I am born and raised in the local area. I'm from Carter County. I went to school as a non-traditional student while I had a couple of kids, so definitely something that I can relate to with some of the students that are applying to the program now. I graduated in 2018 from the Morehead campus, so it was definitely a goal that I had set for myself. So dream job, you could say that, yes. So this is home. You know, as I've already said, born and raised in local Appalachian region, I've always worked and tried to give back to my communities. So having a hand in being able to educate the future of healthcare is just a privilege, and that's how I view it. Being able to promote and provide the physician assistants that can actually help bridge the gap with healthcare, particularly in rural locations. There's no greater gift. Not really something that I saw as a child. My mom asked me whenever I was growing up, what do you want to be when you grow up? My answer was a teenager. So I guess I made it, right? I made it to the teenage role. I decided that I wanted to do healthcare when I was in high school. We had various programs and job opportunities and shadowing, those sorts of things that we were able to do. I became an x-ray tech straight out of the gate, straight out of high school. I went to x-ray school, and so I was actually in medicine for 20 plus years before I decided to apply to PA school. It was there when I started working in some local clinics that I thought I can do more. I can give back. I can do a whole lot more for these patients. I had a mentor. He probably doesn't know that he was my mentor, but it was a physician that I worked with, an old school doctor from Carter County. And I talked to him frequently and, just said, do you think I can do this? Do you think that I have the chops for it? And that's what he would say. He said, Misty, just listen to the patient. They'll tell you what's wrong with them. And that has stuck with me all through the years. Definitely was a motivator to go to PA school. And now here we are, 10 years later. Here I am. I love to talk to people about my PA journey. One thing that I tell them is you've got to have your why. Always remember that. Always remember what you want to do. Taking care of patients, giving back to your community, which was definitely something that pushed me. And don't take no for an answer. If one door is closed, there's probably a window that's open. So you just got to look for it. So we're really looking for that grit. I like for students to come to me with lots of options and opportunities because I love to talk to them through all of the processes that are available. As far as what prepared me for this, I would say leadership, truthfully. PA school really taught me how to lead a team, to be part of a team, to work with interprofessionally within the team. So I think that that's probably, probably the biggest thing that I got from PA school. One of the things I love most about teaching is the light bulb moment. You see students throughout the didactic year, they're absorbing all sorts of information. Maybe they're fretting about a test, they didn't quite get the grade that they wanted. But then when they enter the clinical year and they start to get that preceptor feedback and they know more than what they actually thought. They're connecting the dots, the light bulb is going off. That is one of the absolute best feelings. So as an educator, that's my why. I love to see students whenever they come back to campus after they've had a 4-week extended rotation and they tell us all of their stories, that they're able to help patients or that they're able to actually see the things that they're learning about in the textbooks. That's the best part. We talk to our alumni frequently. We try to maintain some sort of engagement and try to recruit them to be preceptors for our program. Hopefully that is also something that you can take away from the UKPA program is that desire to give back and that desire to help the younger generation. A lot of our preceptors are alumni, but a lot of our preceptors are people that have a desire to teach. and people who recognize that, you know, there's going to be a day and time that we're going to retire. So we are going to need to kind of pass on the torch, so to speak. So there's local hospitals. We're still building collaborations with many other facilities. Actually, you know, had a conversation about a couple of other facilities that were wanting to onboard with us with new preceptors. So we're continually growing. We're continually branching out, particularly in a lot of rural locations. You know, they hear about our reputation, and they want to have our students. They want to recruit them as potential employees for the future, because again, we're still trying to bridge all of those gaps. We've just wrapped up our 50th anniversary celebration for our program. We'll be around 50 plus more years. We want people to be part of the program. We want to carry on the legacy. We want to continue to promote and push healthcare providers into these rural areas to try to help bridge the disparities and the healthcare access that is out there. We want to recruit preceptors, continue to be proud to be part of our program. Being able to give back to our community. You know, I continue to practice clinically. I think patients have a tendency to really relate to people who sound like them, who look like them, who know similar locations and people that are in this area. That's what we're about. That's what we want to recruit, and that's why you should be with our program.